Dr. Gina Nichols of TheRealDr.G, Dr._G, and I have a medical practice that I do primarily weight loss. But with that being said, of course, this is the season. Many people are still taking their health seriously, and their lifestyle has changed. Even though we're all having all the holidays and getting gatherings and graduations and travel, a lot of us are still on our A game. Okay, if you watch my stories yesterday, I posted a patient that has been losing weight, and not just coming to me, but she also exercises, and so she's got a team of people helping her lose weight and look the way that she wants to look, because she's looking for a lifestyle change. Many people come into me and they want to lose weight. They talk about their friends, and well, they tried this drug, that drug, how much can I lose in a month? It's never going to be one particular medication that's going to help you lose XYZ. And gradual weight loss is the best place to be anyway. It's actually recommended that we lose half a pound a week now. A lot of people think 2 pounds a month, that's horrible. It's actually not. You're more than likely to keep it off. Studies have shown if you lose it slowly. So the stories with the young lady there, I'm not going to talk specifically about it, but I will talk about some of the weight loss programs that we have going in the office now. I'm seeing people lose anywhere on the semaglutide, the Wegovy, that so many people are excited about. To be honest with you, more of those people are losing about 4 pounds a week. 4 pounds a month, as opposed to the 10, 15 pounds that I was seeing in the beginning. But that's okay. Once again, 2 pounds in a month is really great. Semaglutide is on back order, or the Wegovy is. Wegovy, Ozempic, Mounjaro, they're having some supply chain issues, and that's the medication that is that helps you. It's a once-a-week injection, curbs your appetite. The medication that a lot of people come in asking for, it is on back order, so that's something to think about. But I can get it compounded for anyone that comes in and can't actually get the name brand from the pharmacies. So that's been working out for people. Some changes have taken place in the state of Ohio when it comes to phentermine prescribing. It's now that people can be on it as long as they want to, as opposed to just being on it for 3 months and off for 6 months. The great thing about this is now we should see people consistently losing a lot more weight than what they were before, because they were really being subjected to yo-yo dieting. I did have one patient who had always only been on the phentermine, and she would be up and down. She started on this program and combined it with the fat-burning injections, and in her first couple of weeks she lost 11 pounds, and she's never lost, even over 3 months she didn't usually lose 11 pounds. So it's great to have a combination and a program that you can actually be a part of to help you lose weight. And that's the Lose Weight Feel Great program. If you're interested, then the information's in my bio, how to reach me if you would like to join that as well. Okay, some of the people that I'm seeing that have come into the office that have weight gain and are not able to lose it, many of them are people that work from home, and some of the things that we've come up with and noticed is common for them is that they snack throughout the day. Okay, even if you follow the stock market, and they've talked about how snacking and the sale of stocks for snacks is actually increased. So you want to think about it when you go to the grocery store. I always recommend that you shop mindfully when you're in the store. And above all, if you buy these things, even if you're working from home, you want to pack a lunch as if you are not working from home. You don't want to go to your refrigerator and shop for food to eat, in the middle of a day. And then you also want to make sure that you're taking your breaks. It can be super easy for these patients to sit at the desk and eat at the desk and never take a break. That is not a good thing to do either. Take your break. That break can be walking the dog. That break could be, walking, up and down your stairs. It could be jumping on the treadmill for 10, 15 minutes. But you need to get up and get moving, because a lot of people think that it's truly, being overweight that's causing health problems. But what we're concerned about now is actually lack of activity, and that's someone who's not, hello, how are you? Someone who's not been active for 2.5 hours. That's a person that needs to get moving, okay? For every 2.5 hours that you are sitting still, you need to be moving for about 10, 15 minutes. And you don't have to think about, okay, do I need to go to the gym and spend 2 hours in the morning, early in the morning before I get started working? Not necessarily. If that's what you like to do, I take my hat off to you, more power to you. But you can get your exercise throughout the day, and studies have shown if you get a total of 30 minutes in the day, that's just as good as going to the gym. Thank you, and spending 2.5 hours working out. So get it in where you can fit it in, as they always say. Okay. What I've also found with this new Lose Weight, Feel Great program that I've designed for the patients, and is going great, might I ask, is that combination treatment, treating the weight loss from 2 different directions works great. For instance, I'll combine Topamax or Topiramate with Wellbutrin, depending on what the reason is for the patient not having been able to lose weight. Works great together. This new Lose Weight, Feel Great program is the phentermine combined with the B12 or the fat burning injections, working very great for patients also. So if you hit it from 2 different directions, if it's determined that you are in need of medications, then that typically works better than just taking one medication. And the big thing is I could give you the recipe to lose weight, but if you're not ready, if you're not committed, then it's not going to work. And sometimes it can be hard to lose weight in the summer when you have, all of these celebrations and the drinking and just being with friends and just beautiful weather. It makes us all want to just forget about everything, right? Our diet included. So, you just have to make sure that it's time for you to lose weight at that time, okay? A lot of people, different medications are chosen. So people, when they come in to see me, we normally have a talk. A decent amount of time is spent getting history and finding out what they've tried and what the reason is for them not being able to lose weight. And based on that, I will determine if I need to do blood work or if I can just start on a medication that is based on the history that I have received from the patients. Okay, some people are mindless, kind of boredom, eaters. Other people eat when they're in stress. I had one lady that came in this week. She's back again after years. It's been a long time since she's been in my office or needed my services. She typically cannot sleep at night, and so she gets out of bed and she's moving around and she's eating because she can't sleep. So I've seen people in the past that I have actually helped get some sleep, do something that we call sleep hygiene, and or if that doesn't work with the good sleep hygiene, then I typically can give them a medication that will curb their appetite and help them sleep. And many people have simply lost weight with that, and it's not even a weight loss medication, So it's really about finding out exactly what the reason is for them not being able to lose weight or for them gaining weight, Occasionally, most people when they come in to see me, they've tried something in the past to lose weight. Okay, Atkins diet. I have people come in the intermittent fasting. People may change to being pescatarian or vegan or vegetarian. All those different diets. And I always tell people that there is some truth or something about each of these diets or most diets that actually can help you lose weight. Okay, it's just really about picking out the parts that really work. Okay. And so, for instance, intermittent fasting. A lot of people are saying, now, intermittent fasting really doesn't help you lose weight. Intermittent fasting can help you lose weight. I have a decent amount of people that are using intermittent fasting with other combination treatment that they are actually, hello, how are you? They are actually losing weight. The big thing is, as you saw on the internet, intermittent fasting, they would say to eat between the hours of 12 noon and 8 p.m. That's not the best way to do intermittent fasting, in my opinion. I normally tell people to use the intermittent fasting between 10:30 in the morning to about 4:30 p.m. is when they should be having their last meal. And that typically, thank you so much, and that typically helps people lose weight with the intermittent fasting. So it can work. Okay. When is diet not enough? When you try the different options, most people use Dr. Google, I say that loosely, and to find the different options or things that they think may work for them. And when all of those things have failed, then they usually seek out the assistance of a professional to just really kind of help them bring things in and kind of circle back and figure out, okay, what kind of what works, and why did one other option not work, So sometimes you can get it from the history, what is the best way to help the patient lose weight. Other times you might need to actually draw blood work. So that'll be physical, or from the history you get information. For instance, someone that has polycystic ovarian syndrome, or PCOS, may be someone who talks about irregular cycles. Or I had someone the other day with hair underneath her chin and then a rash along her neck. This is someone that may have PCOS, and it's kind of important to know about the diagnosis, because this is, you may at a higher incidence of diabetes, also infertility, those different things. So you're going to want to get some information from the history and determine if you're going to draw blood work or not. Many people come in already with physical blood work. It's great to always bring that with you, so we can take a look at it and see if there's anything on the blood work that can assist us with your treatment or management. But you don't have to. It's not required, but it's appreciated. Wegovy, we'll circle back to the Wegovy or Ozempic, Mounjaro. These are all kind of the same category of drugs. Okay, that's the weekly injection that everyone is talking about. Things have been going well. When it first came out, let me tell you how it works. It basically works in the brain to slow the mobility of food, movement of food through your GI tract or through your stomach and your bowels, okay, which is great. So it makes you feel full, but you have sometimes that people may have reflux symptoms. Can you use it if you have a history of GERD or reflux? You can, but probably the dose needs to be increased slower than it would with someone who doesn't have a history of those things. I know they were talking in the beginning about bowel obstructions. I've not seen anything like that with my patients. I will say that everything's been going pretty well with this medication. In the beginning, they talked about losing 5% of your weight in the first, I want to say 90 days or so, or 150 days. I've been seeing people really overachieve on this medication. So I think it's a great medication. It's definitely a great option for people to consider. Okay, it can be a little bit pricey if the insurance doesn't cover it, and then it's on back order like I talked about earlier most places, but there are special pharmacies around the country that can make it available if you have a provider that works with them. Okay, there is an oral form, because some people will say, I really don't want to take an injection or a shot, even though it's only once a week and it's a super tiny needle. But some people just don't like needles, so there is a pill form of it, and it's called Rybelsus. So that's something that you could think about if your issue is that you never feel full and you feel like you could always just eat more. That's one of the people that I grab this medication for first. I also grab it for someone who has diabetes, or someone that may be pre-diabetic, or someone that may be has signs or symptoms of possibly becoming diabetic in the future. That's a medication that I grab, and it works pretty well for everyone. So I've seen some people lose 60 pounds in 6 months. That's probably the biggest weight loss I've ever seen on this medication, but typically it's about 4 pounds a month. But I think it's a great medication. Even after you've lost your weight, you can even use it for maintenance, not necessarily being on it the whole time, but let's say after being off for 3 months, if there's some weight gain, you could definitely come back and maybe take a month or two of it and lose the weight that you regain, and just use it as you need it, okay? You do have some people that are slow responders. Many people, I know myself personally, it took me 8 weeks to see a single pound of weight loss with the medication, but you just have to stick with it and keep moving forward, okay? It's really about time, consistency, and planning. And that's really it. That's all I have for you guys today, just focusing mainly on weight loss and getting their bodies, they want their bodies to look a certain way with the BBLs and tummy tucks and hello, how are you? And I'm never one to say that that's not okay, but we got to come back to why it's super important for us to be healthy and lose weight as well, even though the BBLs are not necessarily healthy, but I covered that in some of my other talks. But today I just wanted to touch on hello, how are you? Touch on the reason why we should want to lose weight, other than just our physical appearance or the outside to look appealing to other people. So Botox, I did have an interesting patient that came in this week that we ended up using Botox actually for a nose lift. I like to talk about Botox itself, which is temporarily relaxes the muscle. It can lift. It can also relax muscle here and do a lip flip. I've done several of those this past week also. But then there was another patient that came in which has a bit of a droop. As we get older, I mean, with gravity, everything droops. Everything kind of moves in different ways. So we all want to put things back the way they have been, as close as we possibly can, obviously. So I ended up doing a bit of Botox in this area here, which allowed the nose where it didn't, when it comes down in this way or droops, so it lifted. You can actually do a nose lift with Botox. So I thought that that was interesting, something that we did. When you think about Botox, I know most people think about it in the area here for the 11s. I think the forehead also, but it's really popular in a lot of different areas. For a brow lift, you can use Botox. Also for the lip flip, that's become really, really popular nowadays also. You can also use it on the neck for a neck lift as well. So just keep those things in mind. And I think the great thing about it is when I did Botox on a young lady last week, she was just really surprised about how affordable it was. And her statement was, wow, I can afford to do this all the time, or keep this up too. So, you know, just think about it. If you have an area that you're concerned with, schedule an appointment and see if it's something that, you know, that Botox can be used for. You'd be surprised. Contour, a lot of people are coming in now to get contour. Contour is where you use heat. Hello, how are you? Is where you use heat to break down on the different areas of the body, the fat, and tighten the skin. Some people have really good results. I posted someone weeks ago that had it done on their arms, that they've been working out at the gym and everything. I mean, their body looked fabulous, but they just had this little nagging area underneath here that they really wanted to get tightened and didn't want to have surgery for. So they came in, they did get 3 sessions. By the second session, though, when they came in, I get pictures usually when they start, and then after, or right before each session. Right before her 3rd session, she had decreased probably about 2.5 inches in the diameter or the distance around her arm with just the 2 treatments. We did go ahead and we did the 3rd treatment, and she is just ecstatic about it. But what I want you to realize is that it takes time. When you stimulate the body to form collagen and elastin, you're going to want to plan ahead, okay? I prefer 14 weeks or so to see really good results. Like I said, this young lady, I want to say 3 weeks, because the sessions are done once a week for a total of 3 weeks. She was 2-3 weeks out, and she had really amazing results. And the great thing about it is, guess what? Her results will continue to get even better. So the results that we saw when she was in the office, they will get better and better, okay? It is pretty much considered a semi-permanent or a permanent procedure. Many people I hear talk about it as an alternative, based on an alternative instead of having liposuction. So I don't know that I would say that, but I do think that the results are comparable. So think about contour. If you're planning something coming up maybe in the next couple of months, 2-3 months, I would get started right away. So once again, you can reach out at the end of this or throughout the week. Anytime you guys can DM me any questions that you have, and I will answer them, or I can get you scheduled as well. Skincare, huge right now too. We all got to take these masks off. I tell you, didn't have to worry about lipstick when we were wearing the mask, right? But now they come off, okay? So, just remember to wear your sunscreen, obviously. Preparing your skin to be out from underneath the mask and in front of everyone. PRP facials are great. I don't know if you guys know what those are. They're platelet-rich plasma facials. It's when you draw blood and separate it out, and you take the platelets and you put them on the face, and then you use like a derma pin to go across the face and basically embed the platelets inside of the underneath the skin, and that helps again collagen, elastin, makes the skin look more youthful. All great things to think about, but I will prepare for that as well. Now is a great time to do it because it's not so hot, there's not so much sun exposure, so I would definitely think about what you're going to do to get your skin in order for the summer also, and the different family functions and events, okay? LipoDissolve, I am going to be bringing it back. When you think of LipoDissolve, it's natural medications or medications that are built of, for instance, phosphatidylcholine is found inside our body naturally. They've been using these procedures where you inject it in the area that you want to break down fat or tighten skin. It's been used in France for more than, since probably back in the 1950s or so is how long it's been used in France. Works great. Really no downtime. Also no downtime for LipoDissolve, no downtime for Contour either, no downtime for Botox. No. Now with the LipoDissolve, there could be a bit of bruising because there's a series of several different injections that you place there. I've got someone coming up that's going to be having this procedure done in the next week or so. So when I do it, I will go ahead and I'll get video so you guys can see exactly what it looks like, and I'll post it on my page. Okay. One patient that I saw this week that I thought was really exciting. She came back. She had been with me years ago, and she said that she'd lost so much weight that I hadn't seen her in 5 years. So of course when she came in, I said, well, hey, how's everything been going? And she said, COVID did it, being at home, working from home, not being active, and everything started to turn back. But she was able to maintain over the last 5 years before COVID, her weight at a healthy weight with all of the techniques that I taught her about her weight. Now, when people think about medical weight loss, I know a lot of people think of medications, but guess what? In my office, it's not just about medications. It's about lifestyle changes, because I want people to be able to learn tools that will allow them to continue to not just lose weight, not just become healthier, but also to maintain their weight loss. And so when I see someone that comes back in after several years of having seen me and lost the weight that they desire to lose, I'm really excited, and especially if there's someone who chose to do it without actually having surgery. So this is really great for me. I was excited about her. Also, the other lady that I had that lost, I'm going to try and bring her live. I did have one patient in yesterday that said she was the thinnest she'd been since she had children. So that would be about, I think she's 60, 65, so I want to say it's about 40 years now. But she lost 20 pounds this past month. She came in at 198, and yesterday she weighed in at 157. And that was actually the beginning of her third month, so that's after 2 months. So she's coming back in. Hello, Peaches, how are you? So she's coming back in 1 month. And so we're going to go live, and I'll have you guys chat with her. It won't be during this time because my office hours are different. So likely on a Monday, I will, 4 weeks from yesterday, I'll bring her on, and she will talk to you guys about what it was like to be on the weight loss program and how happy she is and how it's changed her life. And she's even gotten her husband to come on board with the changes that she's been able to do. He didn't actually come to see me, but she's been able to relay information to him that I have actually taught her. So very excited for you guys to meet her. What I wanted to do today was I talk about the cosmetics and hot girl summer, getting ready, all those different things. This is all great, but I didn't want us to miss at least talking briefly about the reasons why we really want to lose weight, because everyone's like, well, what's the big hype? Because it extends our lifespan, right? We want to be healthy. So I decided to talk about some things that we can expect to change when it comes to our health standpoint when we lose weight, and different things that are even related to it. I think a lot of people didn't know that when you're overweight or obese, your chances of something even like breast cancer is increased. So there's some things that are very obvious and others that are not. So diabetes, I get a decent amount of people that come in my office that are diabetic, that when we get blood work, because normally we do a physical, we talk to the patients when they first come in, and if they haven't had blood work, we draw blood work, and then we bring them back and we go over the blood work. There's been more than just a few that actually have been diagnosed with diabetes after we have reviewed their blood work. Not even just diabetes, but you could even be pre-diabetic. Pre-diabetes is something that I take very seriously in my practice as well. I've been pre-diabetic before, and so even pre-diabetes is a reason to make sure that you keep yourself at a healthy weight. And I'm expecting that weight as far as obesity and being overweight is going to increase after COVID, because the people that I'm seeing that are coming into my office have gained anywhere from 30 to 50 pounds with COVID. So, hey, how are you, Peaches? Thank you. So diabetes, how are you going to diagnose diabetes? So customarily it's blood work, okay? You may have someone that has signs and symptoms of diabetes and doesn't even know it though. Those signs and symptoms that you could see, but I would not rely on them, would be the 3 Ps, or just increased thirst, increased urination, okay, or 2 things that you want to look for, and then increased appetite. Okay, so those are things that you want to think about. But when you go into the doctor's office and they do blood work, there's something called hemoglobin A1C, which is like a 3-month window of what your blood sugars have been doing. We customarily look for the blood sugars to be greater than or equal to like 126. Another way to diagnose it, you can check the blood sugars 2 hours after you eat, which is called usually the postprandial blood sugar, and then which actually customarily is the first number that will be off, okay? And then also after eating within an hour, there's a one-time level of blood sugar that you can have that automatically kicks you into that lane of being diabetic. The 126, that's based more on the fasting blood sugar, okay? So diabetes, why is it important? I think we should know it's important because it affects pretty much every part of our body, right? Our vision, our heart, our kidneys. Hello, how are you? And most people would be so concerned about when they are diabetic, concerned about their kidneys, and them not working or losing a toe or something along those lines, because it affects the blood vessels. It affects the blood vessels. But with that being said, the main thing that diabetics die from is actually heart disease. And guess what? The main thing that women die from also is heart disease. So everything else, not saying they're not important, but I like for us to keep in mind the top things that are causing us to shorten our lifespan. One more thing which I'll talk about, I've got some other things on the list here, but number 2 is high blood pressure. Simply losing 10 pounds can make the difference between 10 points on a blood pressure, okay? Of course, it's always changing what's normal, what's not normal for blood pressure. It's based on age. But I will tell you, studies years ago stated that if your blood pressure is less than 120/70, that gets you an extra 5 years of life. Okay, so I always think about that number with myself. Now, not saying that every patient that walks into the office and they have a blood pressure, let's say 135 or 130/80, I'm going to put on blood pressure medication. No, normally what I do is find out what their risk factors are. How can we get this lower? Do they need to be more active? Of course, increased activity can lower the blood pressure also. Do they need to lose weight? So BMI, body mass index. What is their body mass index? Let's help you lose weight and try and get your blood pressure down. So those are just a couple places. Are you eating too much salt? You need to watch the salt in the diet. They used to think years ago, hello, how are you? They used to think years ago that salt did not cause high blood pressure. But no, salt does. So we all want to be cautious with how much sodium we have in our diet. It is not just in the salt shakers, it's in the processed foods as well. But that's another conversation as well. So those are the 2 things that I wanted to talk about. I have some other ones here. I know the lady who lost the 40 pounds in the last 2 months, she had foot pain, plantar fasciitis, sorry about that term, anyway, just inflammation of the ligaments that run across the base of the foot. And she says she doesn't have foot pain anymore after losing this weight. So if you have an issue with joint pain, foot pain, think about losing weight and seeing if that actually helps the pain that you're actually going through. okay? And you might not need those injections. You might not need the joint replacements. I've had patients that have come to me with knee pain, hip pain, and actually they were sent by the actual surgeon and told to try and lose some weight first and see if that helps out the pain. So I would definitely think about losing weight before choosing to treat joint pain with surgery, okay? And many people will come in and they'll say, well, Doc, what's the likelihood of me being cured of these ailments if I lose weight? If you're significantly overweight, the likelihood of curing any ailment that is associated with being obese or overweight is very good. Probably closer to about 40 to 50% chance that you can at least make an improvement, and many will actually not be diabetic anymore, not have high blood pressure anymore, all those different things. So just a real quick overview of some of the things that can be associated with being overweight and why it's important to lose weight other than just to look a certain way and feel a certain way about our bodies. And I'm going to stop there. I'm going to ask if there are any questions. I will pick up again next week, and I'm going to talk a little bit more about how to get started with losing weight, and we'll even touch on some of the other things that you want to think about that are related to being overweight and that you can make a change if you simply decide to to lose some weight. So if anyone has any questions, you can go ahead and post them about any of the cosmetics, how to come in and have a talk about where you are. Remember, you guys, to follow me, like, comment, share, give a thumbs up, and I'll see you next week. I believe so. I will be out of the country next week, but I do plan on being here again at 12:30 for the beach, St. Martin, right? Okay, that's a good question. Someone said, how do you know if you're overweight? Well, it depends it's based on your height and your weight, okay? A lot of people ask, they say, well, Doc, I'm 60 years old. Do I really need to be as thin as I was when I was 20? It's not based on age. Currently, the definition is based simply on how tall you are and your weight. So when you look at someone, you can be overweight. You can be a normal body mass index, so you use the height and the weight to calculate the body mass index. Then you take that and you put it in different groups. So there's a normal body mass index, okay? There is an overweight body mass index. Then you move into obesity, and that's separated. Obese, moderate, and then morbidly obese, okay? So, of course, the risk of these complications, death, that sort of thing go up or increase as the level of obesity increases. But great question. Any other questions? And that's usually a calculation that we do in the office. I do that calculation every time someone comes into my office. Any more questions? Hello, how are you? Taking any questions on weight loss or the different cosmetic procedures, Botox, Contour, Lipo-Dissolve, skincare. And if you guys have something you'd like to learn about, you can always feel free to send me a DM, and I can cover that for you as well. Or you can upload questions after the session is over. Hello. If there's no more questions, I am going to give it a couple more minutes, and then I'll sign off, and I'll see you guys next week. If you haven't seen St. Martin, I'll try and be on the beach, so then you can get a look at what St. Martin looks like. It's my first time in St. Martin, so I'm pretty excited. Okay, another question. What is the status of Lipo-Dissolve? That's a good question. Well, and I think you're saying status because I did I was providing LipoDissolve before, but then with COVID and everything, it became a little bit complicated to get the contents or the supplies. But I have a new supplier, so I'm really excited because I do like LipoDissolve. I've had it performed on myself, and it's something that was even in my practice before the contour. Before, it was probably one of the first procedures that I offered back almost 15 years ago. And when you think of LipoDissolve, Kybella, I don't know how many of you are familiar with that, but Kybella is actually LipoDissolve. It's just one that they went to the FDA and got approval for. But LipoDissolve, when it's mixed in the office and performed, is a lot less expensive than Kybella. Kybella is very expensive. Great, I'm so glad that you're excited about the LipoDissolve. I'm excited about it too. But you do have to prepare time-wise for LipoDissolve also, because whereas I stated there is really no downtime, but there is some swelling that takes place, and there's shots, several shots that you're spacing apart in the area where you are trying to break down the fat or tighten the skin. So you will be a little bit sore. And LipoDissolve pretty much can be used anywhere. I mean, underneath the eyes, I've had it there before. Under the jawline or the chin, I've had it in that area before. Also on the arms, the sides, the abdomen, the back, huge place for LipoDissolve. So lots of areas where you can use LipoDissolve. People that I customarily do not do LipoDissolve on, I don't do it on diabetics. When I took my first course years ago, I was always taught that you're real cautious with diabetics as far as the healing process. Diabetics don't tend to heal as well as other people, so there's just a lot of shots, and so it might increase the chances of infection in them. Any procedure that you perform, there's always a risk involved, okay? Risk of infection, risk of bruising, risk of bleeding. I've never had any of these issues when I performed it in my office. So, alrighty, how quick do you see results from LipoDissolve? I've never heard of this procedure. Great, Roxy. Yes, LipoDissolve, you're going to have inflammation, and it's crazy. I always tell people, the people that from my experience, the more you swell, the better your results tend to be. LipoDissolve, I would say, so I will perform it. So you have the injections, and then I normally say about 3 weeks later you do it again. So I usually recommend that you have 3 sets of those, just like the contour, 3 weeks apart though, instead of 1 week apart. The results, I would say look for your results after the 9th week. You are going to swell, like I said, and I normally have people wrap the area or put on some sort of binder, which I even have binders available in my office if you're having it on your back or on your abdomen. And I think the results are good. You can see as much as I've seen 4 inches before. In the courses they talk about even up to 6 inches that you can lose from LipoDissolve. You would want to also make sure that you are maintaining a low-fat diet, because you're breaking down or destroying those fat cells, but you're not going to be able to destroy all of the fat cells, okay? So you don't want to continue to feed them. So some exercise, water, drinking plenty of water, and watching your fat intake, which is something that I talked to you about, you're going to have really good results from that. But you can see results after your first time. It just depends on the person, but I never guarantee seeing the final results until after that 3rd treatment. Good question, Foxy Brown. And we have another in between the legs. So a question was, can you perform LipoDissolve, I'm assuming, in between the legs, or is that area too sensitive? No, you can get LipoDissolve in between the legs. I usually put on a layer of lidocaine, and I allow it to sit for about 20 minutes, which numbs the area somewhat. And then I don't use the needles are very small also. So on a scale of 1 to 10, it just depends on your pain tolerance. I have a high pain tolerance, but I've never had anyone that wasn't able to make it through the complete procedure, or decided they weren't going to come back to for their follow-up procedures because of it. everyone in general has been very happy, and that's why I sought to bring it back, because other people that had it years ago wanted to come back for it, and they were calling the office. So I decided to see if I could find another supplier, and I did. So I'm sorry, let me see the other questions. All right, great question. The question was if you wanted to use just a little bit of fat. Great, Foxy Brown. Yes, thank you, hon. Well, we will definitely talk about when you come back in next time. So the question was, if you want to lose just a little bit of fat from an area, is it better to do contour or lipo-dissolve? It really depends on your own preference, okay? What I will say is, from my experience, lipo-dissolve works great to break down the fat as well as contour. But when it comes to fat and skin, I think I would lean more toward contour. So if you have just a little bit of fat that you'd like to lose, I would say lipo-dissolve would work great for that. But I haven't seen huge results of the skin tightening, at least not immediately when it comes to lipo-dissolve. Hopefully that answers your question. Yes, so if just a little bit of fat, not loose skin, I would go ahead and just go with the lipo-dissolve. If you have the loose skin and the fat, I would go ahead and try the contour. Lipo-dissolve is a lot more affordable than the contour, though. Great question. Okay, great. Let me question. Okay. Can you use care credit for lipo-dissolve? Yes, you can use care credit. Hello, Mrs. Cates, how are you? You can use care credit for, we do accept care credit in the office, and I believe that there are no restrictions on the procedures that you can use care credit for. I think there may be a dollar amount that care credit allows, but that would be something for the staff in the office. I'm not familiar with that. The exact dollar amount, the limit, the lowest number that you can use care credit for. There's another question. Health spending account. Yes, you can use it, your health spending account if you have one, also for this procedure. So because it's performed at our doctor's office. Really good questions. I'm so glad for the all of the questions today, the dialogue. Any more questions? All right, I'm going to go ahead and sign off. Like I said, I'll be going live again on next Thursday. I will be out of the country, but if I have an internet connection, I will definitely be here, and it should be at 12:30 p.m. Eastern Standard Time. And if you want to see what St. Martin looks like, stay tuned. I'll be getting as much video as I can and going live as often as I can also. So have a great day, you guys. That's so cute. You got to get ready for this summer, Doc. I absolutely do. I have been working on it. So all of us got really comfortable during COVID, really comfortable, but there was a lot going on. I think, at least myself, my general appearance wasn't really the main focus when COVID was going on. So I'm still seeing patients and all that. I was really more focused on just trying to make sure everyone stayed healthy and alive, to say the least. So, but anyway, that's all behind us now. Better days ahead. I'm going to go ahead and sign off now. If you have any questions after this, be sure to send me a DM or drop them in the comments here, and I will see them afterwards. I have a question here. Okay, hello, how are you? That's a good question. Yes, it's someone who, today, a former colleague that took a medication. It was a shot that helped him lose a lot of weight, but it was $1,400. It's probably in this category. It probably is. Now, insurance, if you have an insurance that covers it, and some insurances do, and that's usually the Wegovy or the Manjura, then usually there might be a $25 or $50 copay, and that just depends, okay? There are also some copay cards out there that you could look for that might help you out with the cost of the medication. But the $1,400, that sounds about right if you were going to pay out of pocket with no insurance, and it comes from the pharmacy, and it's name brand, so to speak. If you wanted a generic form of semaglutide, once again the same category is the same medications, then you could reach out to a provider that works with a compounding pharmacy or pharmacies that mix the medication and distribute it to doctors that are a part of their program. Very good. Very good question. Thanks for that question. So it's a lot more affordable. It's not $1,400. It's not even a third of that cost if you have a doctor that is able to prescribe this medication and get it from a compounding pharmacy. Hey, you guys, I'm going to go ahead and get started. Hello, how are you? I'm going to go ahead and get started here today. I haven't been on here in a couple of weeks, but I wanted to touch bases with you guys today and just really talk about some of the things I've been seeing in my office and my practice. Of course, this time of the year, weight loss is huge, and everybody's talking about the semaglutide. Hello, beautiful. How are you? Yes, thank you. But you know what? There's so much more to it than just semaglutide. I mean, there's a couple people I've seen even yesterday. I saw 2 people that were down 11 pounds in 1 month. One of them was on semaglutide, but the other one was actually on a combination treatment of the B12 with the phentermine. So there's more than one way to, quote unquote, skin a cat. I did see someone yesterday that is in the office that is working from home now, that is going to be, hello, how are you, is going to be restarting. She talked about how she's tried phentermine a couple different times in the office. Hello, the first time it worked out really well for her, but the second time she said she really didn't lose a lot. So once again, if something works for you in the past, doesn't mean it's going to continue to keep working for you. The great thing to think about with her is that diet is huge since she's going to be working from home. There was just recently a study out that said that they're expecting snacks to be huge when it comes to the market share. Yes, I think they said something like $500 million they're expecting to sell in snacks because people are at home and they have very easy access to snacks. So I encouraged her to pack her lunch as if she's going to be going to work, and don't go shopping in her refrigerator when she's bored or just kind of walking through, and also to take frequent breaks, of course, and do the steps, those sort of things, so remaining active. And above all, don't buy the junk and bring it in the house. It's a lot easier to stay away from it if you're not actually purchasing it or bringing it in the house. So be that gatekeeper. Interesting thing is, actually years ago I started shopping at Costco. One of the huge reasons why I'm so happy I started doing it is because they just don't have a lot of junk there. I forgot about the Fruity Pebbles and all these different types of cereals or junk that I used to eat. It's really just not available there. So, right. Thank you, hon. It's really just not available there. So you got to change your environment also when you're trying to lose weight. The big thing is to have a plan and to have commitment. Okay, I want to talk to you guys about reasons why we overeat. I think it's important to know how this takes place. When you think about the brain, there's three pathways in the brain, okay, that actually cause us to gain weight. One is for those people that eat from anxiety. The other is for people that eat out of boredom. And then also the pathway that semaglutide works in, which is the pathway where we just never feel full. So what I end up doing is when patients come in and they want to try something for weight loss, is I end up talking to them, finding out which pathway it is that affects them the most, and it might require that you use more than one option. Most of my patients that lose large amounts of weight, they actually hit 2 different pathways. So for instance, if it's anxiety or overeating from emotional eating, then something like Wellbutrin or Contrave would be a great medication to try there. If it is due to not feeling full or always feeling like you're hungry, then semaglutide, well, you'll hit that pathway. So that's something to think about also. Recently, there was a couple things that are in the news. They talked about the link between trauma and weight gain, and I've talked about this before in some of my reels and some of my Go Lives also. But that's something that's come up on the radar again. And really, what they're just saying is that when you have these cravings for sweets, these are comfort foods, and these comfort foods release a hormone in your brain which is called dopamine, which actually gives you that sense of that feeling of comfort. that you're looking for, motivation and also pleasure. And it's related to actually the same centers that are affected by cocaine and even heroin. So just a thought there. Couple different things. I have had people coming in asking me about the semaglutide. Yes, thank you, Humphreys. Thank you so much. I do have several people coming in and talking to me about semaglutide and asking questions about it. One of the questions they ask is, can you take semaglutide if you're not diabetic? Or Ozempic, Wegovy, remember different names that it's known by depending on the makers. Thank you, hon. Absolutely, you can take semaglutide if you're diabetic, okay? Initially, it's a medication that was approved in those that had diabetes, but it was found that they actually lost weight, so they started reviewing the literature for that, and that's actually how it was able to get FDA approval for actually a weight loss medication. But I don't see people that have any issues with their blood sugars going low when taking this medication, so be assured you can take it even if you are not diabetic, okay? When we lose the weight, I know I had a lady that came in yesterday that's been on the Mounjaro. Mounjaro is another form of semaglutide, and she has spread out her dosing, because normally it's an injectable that you would inject every 7 days. She's actually spread it out to every 10 days, and the reason for that is that she said she just cannot eat if she takes it every 7 days, so she spread it out to every 10 days. Of course, its half-life, that sort of thing, is going to be longer than the 7 days that we normally take it for. But yeah, so she's actually been doing really well with that option. But the big thing also to remember is you don't want to become malnourished when you're taking these medications, because weight loss should be healthy, right? So you want to make sure you take a multivitamin, make sure that you're getting enough protein, calcium, vitamin D, to keep your bones strong, and also to keep your teeth from getting loose. Because remember, you have those people that have the gastric bypass or gastric sleeve, and those are people that end up having issues with their B12 and also become malnourished, and you start to lose your hair and that sort of thing. So it's one thing to lose the weight, it's another thing to lose it healthily and be cute with it, okay? So what are you going to do when nothing works? Many of the people that come in to see me for weight loss have already tried other options to lose weight in the past, which is absolutely great. So when do you figure that it's now time for you to go and actually look for assistance? I always think about if you've had 3 failures. You've tried 3 different things, you've given it a good run, 3 to 6 months, and overall you haven't lost any weight, or better yet, you've lost maybe 2 pounds in a month, over every month, or you've gained weight. That to me is someone that I consider a weight loss failure, and someone that should look for help with their journey. Most people that come in have tried things like the Atkins diet. I don't have a problem with the Atkins diet. What I have a problem with is the high fat that Atkins encourages, and that's just because it can collect in your arteries, and you might be skinny, but your arteries are not in the best shape. So that's the only issue I have with that. And then the intermittent fasting, and also vegan. I mean, there's so many different diets out there, okay? Workup that I normally do for people when they come into the office would be a good history and physical, of course. Something that many people don't look for is cortisol levels. Cortisol levels are increased in stress. Also for people that don't sleep well at night. And this is super popular right now because I think all of us are still under a great deal of stress, even though we're getting back out and moving around and trying to get back to life as normal as we remember it being before. But we're still experiencing a great deal of stress. Those things, when we talk about semaglutide, some of the options, some people say they don't want to try an injection. That's the Wegovy, the Mounjaro, the semaglutide, which is a compounded medication, which is the same, does the same thing that the others do. There's also Saxenda. The newer ones, though, are weekly injections, whereas the ones that are the Saxenda is a daily injection. Most people don't want to take a daily injection. But if you don't want to take an injection at all, there is an oral form of semaglutide, which is called Rybelsus. And I have a decent amount of people that have been successful on this medication. What I like to think about when I think about semaglutide, it is something that I've taken before myself, but I like to think about is that it really just allows you to get your eating under control. I know my son had invited me to come and go to an event with him in Atlanta, and I was so excited that I had been on the semaglutide because I didn't have to get ready to get in a formal gown. I didn't have to get ready. I like to say, if you stay ready, you don't have to get ready, right? So that was very exciting for me. Even this year, the first part of this year, when the New Year's came, I didn't have to lose weight on my New Year's resolution because I was already stable on the semaglutide injections, okay? There are some side effects that the semaglutide has, which recently they've been talking about. People having increased bowel obstructions, which makes perfect sense because one of the ways that it works is to make you feel fuller, is it does slow down movement of food through your bowel. So if you're someone that has reflux or has had severe reflux or has had a bowel obstruction before, you probably want to think about some other option or at least be cautious about using this medication. And then also many people that take the semaglutide also have issues with, some people talk about depression, so you want to make sure that that's not been a major issue for you as well. But other than that, great thing about it is that you could have 20 pounds or 10 pounds to lose, and this could be an option for you. And then you can also stay on it as long as you want to. There's not any restrictions that says you can only be on it for XYZ amount of time, so that's something to think about. Again, the FDA approved when it first came out. They talked about in 104 weeks losing about 15% of your weight. I did see someone yesterday who, with a combination of different treatments, she's down, I want to say 40 pounds. And hello, how are you? She's down 40 pounds. Hello, how are you? 40 pounds in the last year. So once again, these things don't happen overnight, but if you're consistent, you can definitely reach your goals, okay? I do ask that people give me at least 12 weeks. 12 weeks is a great place to start. If you have, let's say, 20-30 pounds to lose, it'd be nice to have 12 weeks. I do have some people that come in and have a much shorter period of time. They have a graduation they're getting prepared for, or they want to go on vacation for a birthday. But remember, if you start this journey and then you stay on this medication for quite some time, for usually about 6 months or so, then you normally reach the weight that you want to reach, and you could come back and forth to it. You don't have to stay on it regularly, but you may think about it. I normally schedule people to come back in every 90 days just to check up on them and to see exactly how things are going with them. So I think it's a great option for that reason. They do talk about some people will start on the medication and it may be the first 2 months or 3 months you don't have any response. I was actually one of those. First 2 months was doing everything that I knew how to do, but I have to tell you, my diet really wasn't very bad anyway, but it just wasn't consistent, meaning that probably 5 out of 7 days I was doing everything I needed to do, and then there was those 2 days in the week that I would just splurge, and those were the days that were not allowing me to reach my weight loss goal because I only had about 15-20 pounds to lose. Okay, so when you think about the semaglutide, I think of consistency. It also allows you to remain consistent with what you know you should be doing when it comes to weight loss. What I've seen in my office with people, I've been treating weight loss for more than 15 years now, is I normally recommend, of course, that weight loss, try not to do anything more than 7 to maybe 10 pounds in a month. That's something that, I could definitely help you out with or assist you and keep you from getting from the sagging skin. But we also have options that you can use along the way that will assist with teaching your skin kind of what it used to do, being tighter, okay? We have the Contour in the office, which is a treatment that applies heat. It tightens up the skin and it also breaks down fat. I recommend that people use this treatment while they're in their weight loss journey. So every 15 to 25 pounds, I recommend a treatment on that area that you're concerned with. It can be used anywhere from here down. There's also the Lipo Dissolve, which are shots that we offer And that can help with tightening up the skin and also breaking down fat, okay? And these are all lunchtime procedures that meaning that you can get done in the office and go right back to work, so there's no downtime. When it comes to the face, you can also use filler. You know, there's Restylane, there's Juvederm, which is huge, and these fillers have been out for so long. They're FDA approved in different areas of the face, and they've been used for such a long time, so really not a lot of complications or issues associated with use of the fillers also. But so those are the things that you want to think about. Also, you have the I like to call mine PRP facials or virgin facials that can help you also with tightening up the skin. Hello, how are you? That can be used to keep the skin tight as well. So I just want to get out here, and holiday season's coming, and really last week I talked about doing cosmetic procedures like BBL, different things like that. And one of the things that I stressed was that us as women, when we make these type of decisions, we need to make sure that we're making those decisions for ourselves. You know, I have people that come to my office all the time and they get procedures done like Botox, filler, PDO threads, and they always talk about keeping it a secret from their partner or whoever it is, you know. And of course the partners always say, well, you know, you really don't need it, or you get this done, that sort of thing. And I really just want to encourage you guys to do what makes you feel better about yourself. And when you get cosmetic procedures, I would only consider yourself, not what anyone else thinks about you, not what anyone else believes that you look like, but think about how it's going to affect you, because some of these things can be permanent, you know, such as the people that get the BBLs or the implants in their butt. I mean, that's a permanent procedure, so you want to make sure that you're doing it for you when you make a decision to have these things done. But with that being said, cosmetic procedures are really booming now. A lot of people are calling in, things are picking back up, summer's over. Hello, and now it's time to hit to start getting ready to go around family. Okay, we got Thanksgiving coming up. So also people might ask you, well, you know, what is it exactly that you're thinking of doing that you'd like for me to get you for Christmas or a birthday or something like that? And these are great ideas, you know, maybe think about Botox, throwing that out there for them, and just, you know, getting yourself ready and getting the things that mean something to you, you know. For instance, Botox. A lot of people don't know the different ways that you can use Botox. Botox can be used not just in between the brow area here for brow lifts, and also people think about it in the forehead, but you can also use it to lift the nose as well. That's something that you can use Botox for, as we talked about with the eyelids. Great thing about it also on neck for necklines, and also if you have sagging skin along this area, Botox can be used for that as well. It's fairly inexpensive. It's a really fast procedure, really no downtime, not really any complications. I mean, some people, if it were to move or migrate to an area where it wasn't intended, then sometimes it might take a little bit of time for those changes to be corrected. But they correct them themselves. It's not permanent, so I wouldn't be afraid of Botox, okay? Botox has been around for quite some time. There are some other products that are out now that the FDA has approved that are similar to Botox and actually last a little bit longer, but every time you hear about that, the cost is usually more as well. So I'd have to say I do more Botox than I do any of the other fillers that are out there. Also, people are thinking about contouring or their body, their shape. Contour is a non-surgical procedure, uses heat to tighten the skin and also to break down fat. It can be used pretty much anywhere. The machine I have in the office from here down, okay? It isn't considered a lunchtime procedure, meaning that there's no downtime with contour. Hello, how are you? Who is a good patient for Botox? A good client for Botox? For contour? Pretty much anyone could be. Now, sometimes you will see people say, well, you know what, you should have, your weight should be a certain amount, so a BMI should be less than 33 body mass index. That's not entirely true. It really depends on the area where you're having it done. Everyone has a different shape. So I may see someone in my office that is, let's say, 5'1", 250 pounds, you know, BMI definitely, you know, over 40, and they just have a little bit of pudge underneath the arm, or just a little bit of pudge underneath the jawline here. So that's a person that even with weight loss, more than likely they're not going to get the results that they actually desire to see. And remember, also with contour, you get the skin tightening also. So that's a great thing to think about. So many people, when they're in the process of losing weight, they will use contour because they're concerned about their skin becoming loose and not really having the appearance that they want to have after losing weight. So it is a great option to combine with weight loss as well. And my recommendation is that about every 20 to 25 pounds you think about during the session in that area where you're really concerned, whether it's the belly, it's the upper back, it's the lower back. You can even do it on the knees, the inner thighs, outer thighs. Like I said, it can pretty much be used almost any place on the body where you'd like to see a little bit of breakdown of fat and tightening of skin. Okay? And if you just simply want tightening of skin and not breakdown of fat, there's also, you can do that as well. It doesn't have to be both. So, okay? Also, the fall is a great time for skincare, okay, because the sun and, people aren't spending as much time in the sun. Clearly, you don't want to forget your sunscreen, but think about things like chemical peels. It's a great time to do it in the winter or in fall and winter. And then also PRP facials, which is platelet-rich plasma facial or vampire facials, okay? And that's when you take platelets from the blood and you spin them down and you inject them underneath the skin. You inject it underneath the skin. And you can also use the dermapen or like fine needles that basically go underneath the skin and they stimulate the skin to form collagen and elastin, and it gives that lifting look. That's why it's called vampire look or PRP facial. So that's something to think about. Once again, don't forget about your sunscreen, even though, hello, how are you? Even though it's winter time, you get rays that get caught in the cars that when you're driving, so you want to make sure SPF, I always say SPF 50 or greater, and I wear it year round, okay? And like I said, if you get your skin procedures done this time of the year, then you shouldn't be as sensitive to light and going out in the sun and that sort of thing, okay? Lipo-dissolve, so when we talk about another way that we can break down fat or get the tightening of the skin or contour our body, think about lipo-dissolve. Very similar to Kepo. I don't know if you've heard of it before, but that is FDA approved, mostly underneath the jawline here, but lipo-dissolve can actually be used pretty much anywhere on the body, even underneath the eyes. If you have some puffiness under the eyes, it could be fat. So when you think about lipo-dissolve there, it is a series of shots that are injected in the area that break down fat and also tighten skin. It is considered relatively a permanent procedure, meaning that if you don't gain weight back, if you don't continue to eat large amounts of fat, then those cells they're destroyed, and then the other ones won't actually expand. So it's a great option to use with a weight loss program also. So that's something to think about. Some of the solutions that people look at when they think about weight loss, and they think about gastric bypass. Hello, how are you? They think about surgery. Also, I have people in my practice that have had actually gastric bypass or gastric sleeves, and they've reached different plateaus, and now they're back to actually lose weight, okay, or lose some of the weight that they cannot or haven't been able to lose successfully with the surgery that they've had done. I think the big thing to think about is, to get from this or learn from this, is that there's not going to be any one way to lose weight. People come in. Some people's surgery could be the right option, but others it may not be the best option for them. So that's what I'm here for, is to help you find the best way to healthily lose weight and live a longer, healthier, more fulfilling life. I've had some people that just say, you know what, it's just overwhelming. I just don't know where to start. I've tried counting my calories. I've tried the different diets, the fad diets, cabbage soup diet, the Atkins diet, intermittent fasting, all these different things, and it's just not working. It may have worked 10 years or so ago, but now the same thing is not working. And one reason for that is also the fact that our bodies change. When we go through menopause, or if we have a problem with hormone imbalance, or our life is stressful, then it's not going to be the same game 10 years later. So if you're not losing weight, doing things, and you've exhausted all of your other options, it's a great time to seek out help from a weight loss specialist, and that's what we're here for. So cortisol, of course, if you have a high stress job, this is something that we think about being increased, and what it does is it really just kind of feeds the fat. It keeps you from being able to break down fat. Okay, these are people, when you think about it, that's what's responsible when you see people with a large midsection or the belly area. That's actually cortisol related. Okay, I do have some people that have come in and they hit plateaus. There's some new studies that are out about plateaus when it comes to weight loss. We used to think, you come in or you get in the gym, you get your diet right, you lose weight, you consistently do what it is that you're supposed to do or what you did to help you lose the weight, and everything should be okay. But studies now have shown that, number one, we have 1 year to get that weight off that we put on. If not, our brain gives us a new set point. And once we get that new set point, then it's very complicated to actually get our body to understand that now we're eating less calories. This is all that we need now. Studies have actually shown that 6 years later, our body is still trying to encourage us to eat and go back to the weight from where we have actually lost the weight. So really, you need to think about weight loss as being something that's chronic. More than likely, it's something that you're going to have to think about for the rest of your life, and that's okay because there are options for you. I have seen a few people that have come in that have had just a little bit of weight gain, maybe about 10, 15 pounds. These are the people that you think about a workup for thyroid, or it could even be those that have issues with their hormones like estrogen, okay, those sorts of people. Some people will come in and they may be 250 pounds and they gain 50 pounds, and the first thing they say to me is, "Doc, I think it's my thyroid." Not to say I won't check your thyroid hormone, but thyroid or estrogen, any hormonal issues with weight gain is usually not anything more than 10 to 15% of the weight gain, okay? So it's a great thing to keep in mind, but more than likely, if you gain 25% of your weight gain, it's not going to be due to simply just your thyroid or hormones, okay? Sleep is very important. I remember I had one patient that came in who I helped her lose weight. She actually did my fat burning group, which is when people come in, you can choose a medication, you have weekly Zoom meetings, you have weekly weigh-ins, and you also have the meal replacement shakes and bars that are used. And the most interesting thing is of course, when you don't sleep, then your cortisol level, remember that hormone that causes our stomachs to be larger, that cortisol level will be elevated or increased. But what ended up happening with her was when we finally figured out that she had insomnia or she couldn't sleep at night, we were able to give her melatonin, which is a natural supplement that helps you get sleep. And just by simply getting sleep at night, she was not up in the night eating and going through the refrigerator and trying to find something to do. So sometimes it can be just as simple as just figuring out how to get a good night's sleep. But everything's connected. It's not going to just be one thing. You want to come in, just have all of your information, even your family history, the things that you've tried before, what's worked for you, what has not worked for you, and you just want to come really comfortable and ready to talk about them all. And the big thing is just knowing when to ask for help. Different medications to think about it. We talked about Adipex before. Adipex is okay. It is the one that gives you energy, that you could try that, or B12, fat burning injections. And we also have herbal remedies here that will help someone that actually doesn't have a lot of energy to get moving. But I want to have this disclaimer. I want to make this disclaimer. No one medication is better than the other. It just really depends on what your reason is for not being able to lose weight and keep it off, okay? But phentermine is an option. There's also a medication called Contrave, which is a combination of Wellbutrin with naltrexone. We have 46 different options that we can combine to get you the weight loss that you're looking for. So if I have someone, or even semaglutide, which everyone's coming in and talking about, so if I have someone who just never feels full, semaglutide is one of the medications that I like to suggest to patients. Not everybody can take semaglutide. All of these medications have reasons why you cannot take them. That's why you need to speak with someone and talk to a specialist, someone who knows those that can and cannot take medications. So if you're someone that has issues with your thyroid or a family history of thyroid cancer, semaglutide is not a medication that you should be taking. So, but other than that, it actually works pretty well for weight loss. And so some of the medication, when we talk about semaglutide, we talked earlier about Ozempic. Ozempic is the one that's mostly used for diabetes, but it's the one that everyone thinks of when you think about weight loss. one that is semaglutide that is approved for weight loss is Wegovy. Mounjaro is working on theirs as well. Should be approved, if not today, and very, very soon. There's also an oral, these are all injections that I've just talked about with the semaglutides. There's also a pill called Rybelsus, which is very similar, which can help you lose weight also, but the studies that are out there show that the injections actually tend to work better for more weight loss, okay? They are once a week. These ones that I've spoken about are once a week. There is a once a day, which is Saxenda. That medication, it's very similar to semaglutide. That medication has been out for quite some time, but it's a shorter acting medication. And I don't know about you guys, but I really don't want to take a shot every day. So it's definitely more attractive to patients to be able to take a shot just once a week, you know. And what it does is there are 3 areas or 3 pathways in the brain that you want to think about when it comes to eating or eating too much. One would be you just never feel full, you know. Number 2 would be emotional or anxiety eating out of anxiety. And then number 3 would be more you're just, hello, how are you? Just eating because you're just bored, you know. So semaglutide works in the pathway where you feel full. So, but when you talk about feeling full, you also have to think about what that means for side effects, because some of the side effects of semaglutide come from feeling full. So the most common side effect is issues with your stomach or reflux or feeling like you have, burning in your throat, okay, because it slows everything down. So that's something, if you have an issue with reflux, it might not necessarily be the best medication for you. Also, hi, how are you? Also, you may, some people have talked about, some of my patients have talked about not being as happy when they're on the semaglutide or a little bit blue. I've noticed this as well. So think about that. If you have an issue with significant depression, then it may not be the best option for you. Studies have shown that they are FDA approved, like we talked about early. Initially, they said 104 weeks, 15% of weight loss. I've seen some people come into my office, though, and after, hello, how are you? So people are doing pretty well on this medication. I do like the medication for those people that are actually able to try it. It can be a little bit, if you get it from the insurance companies or if your insurance, if you get the name brand medication, there are some issues with shortages, and there's also, it can be a little bit pricey, but there are some pharmacies around town that, or around the country that actually have this medication a little bit less expensive, and they usually don't have any shortages. And if you're interested in that, you can just DM me and I can help you out with that also. Okay? Some people are saying, well, what about the weight gain that comes back after coming off of this medication? That's a possibility with every time that you lose weight. Probably about 80% of my patients are repeat customers or someone that's returning from having been with me before and regaining weight. How I normally deal with this is if a patient reaches their weight loss goal, or when we reach our weight loss goal, I normally set up meetings every 3 months to check in on them just to make sure that everything's going okay, because it's definitely a great thing to catch people before they gain too much of their weight back. Normally I recommend not any more than 15-20 pounds before you come back in and allow me to help you to get back on track and lose that weight. Another thing is you can use maintenance medications. The semaglutide can be for maintenance also. You've got, if it's cravings, Topamax, Wellbutrin, Contrave, Qsymia, all of these different medications can be available for maintenance. The B12 fat burning injections can be used for maintenance also. So it's not just about losing the weight, but it's also about maintaining the weight and finding something that works for you. Because remember, it's more than likely something that's in your genes. 70% of weight gain is actually in the family. That procedure will probably take me roughly about 5 minutes to do it. This is the 3rd session for this young man. So lipo-dissolve breaks down fat cells and tightens up the skin. It's a procedure that can be done on your lunchtime. There's really no bruising, no downtime. Afterwards, you will notice some swelling, some itching. So I normally ask people to wear like a binder in the area to tighten up, to keep the skin nice and tight and help with the results of the procedure. It's normally done at least 3 sessions. Hello, how are you? At least 3 sessions. Hello, Taryn, how are you? It's done at least 3 sessions 3 weeks apart. Hello, how are you? And that's pretty much it. So most anybody can have this procedure done. If you're having it done, let's say for a specific reason, let's say you're getting married or you're going on vacation, then you would want to plan accordingly, because it's not something that you're going to see results immediately. You're going to have some swelling and that sort of thing. So I always recommend that if you have something coming up, give yourself about 12 to 16 weeks before you want to have your body look a certain way. What person is it? What kind of, where can it be used? Anywhere on the body, actually on the face, underneath the eyes, for what people like to call as bags. Hello, how are you? And also on the back, on the belly is a real common place. Love handles, which is what we're going to be doing on this gentleman here. This is his third treatment. And actually, he had lipodissolve years ago, and he's back for more. Is it a permanent procedure? As permanent as you choose to, if you choose to take care of yourself. And you definitely want to limit the amount of fat, and you want to exercise and try not to gain weight. But sometimes, all of us can regain weight, so you may have to touch up the area from time to time. But it is considered a semi-permanent procedure. So a lot of people ask me, I've been talking about this the last several weeks, the difference between liposuction, the difference between contour liposuction, higher risk. The results should be fairly good, but with liposuction you really don't get much skin tightening. With the lipodissolve you can get skin tightening, and with also contour you can see skin tightening. Contour is a machine which is where you contour is a machine where the skin is actually, when you apply heat, it works from the outside in, and I'll show you guys. I actually have on my website a live session of contour, so there's no needles involved with that. There's pretty much no downtime with that also. So which one would be a better option for you? It just depends. They both work. We would have to schedule a consult. We have to look at the area to determine exactly what's going on. Now, if you have a large amount of loose skin, I would definitely recommend the contour over the lipodissolve. So hopefully that answers some of your questions. I'll go ahead, and once I post the procedure or the video from this, it'll be up for about a week, and I'll answer a lot of the questions that I know you may have about this procedure. So I'm going to go ahead and get started though. If you guys have any questions, you can go ahead and post them in the comment section, and I'll do my best to answer them. If I see them later on, then I will answer them there then as well. So he's already got on some numbing cream, and like I stated, it's really just a series of shots, and the needle is very small. And I'm going to go ahead and show you guys. This is what the needle looks like. It's a super tiny needle, okay? So we're going to clean him up, and then we're going to go ahead and treat the area. And really what we're doing, so we're going to treat this side here first, and so we're treating the area here, and we're going to put up his before and after, so I'm just wiping it off. He's already used the numbing cream, so we're doing that. And then it's just going to be a certain amount, 2 cc's is what I'm using, and it's phosphatidylcholine, and you can mix it with other things depending on what results you're looking for. And it basically breaks down, hello, how are you, breaks down the fat. So I'm going to go ahead and treat it now, okay? And because the needle is so small, it could take a little bit longer to inject it, but I use a really small needle because I want you guys to be comfortable. And as you can see, there's not even any bleeding. I'll turn around and show you when we're done. I'm going to put up his before and after. It should be, I think I should have him up by Monday or so, but I really want to wait the full 3 weeks, because you need to wait the full 3 weeks to see what your results are, because like I said, you will initially have some swelling, maybe some itching, and you're always given information on what to do about the itching and that sort of thing. Thank you. It actually is easy. It really is easy. It seems like it's not, but it's very easy. I'm going to stand up here. I'll give you a little. you doing?
Oh, I'm doing good.
Okay. So that's it for that side in this fringe. So I'm going to turn them around so you guys can see what it looks like. So for the camera here, as you can see, there's just very fine areas. You can step a little bit closer. So that's how small the area is where you can see where it was injected. I'm going to come back this way and then show them, as you can see. And he really doesn't even have any redness yet, so, but that's what it looks like. So now we're gonna go ahead and I'm gonna clean that up, and then we're gonna do the other side. Okay, turn around to the other side for me now. And really super small needle, as you could see here. Same thing on this side. I'm going to stand up, okay? And I usually focus on the area where they need it. Both sides may not need it the exact same area because we're not completely symmetrical, so you may have a bigger defined area or pooch, so to speak, on one side than you would on the other side. So that's why you just need to treat the area, the patient and the area. Complications, I've never had any complications with this procedure. I've been doing this procedure in my office for more than 10 years, so almost as long as I've been in practice, about 15, 16 years. Great time to start it. It is not for weight loss. It's not considered a weight loss procedure, okay? It's a body contouring procedure. You could start this during your weight loss process, or even if you don't have any weight to lose and you just have a stubborn area that you just can't seem to get to go away no matter how much you exercise. This gentleman here, that collection of fat in this area here actually runs in the family. So he said that this is the only thing that's ever worked for him has been lipo-dissolve to the area, no matter how much weight he loses. And that is it. I'll turn around and show you. Also, as you can see, in this area, you really can't even see in any of the areas, but there's several series of shots there, very small needle, really doesn't hurt. We'll show the other camera. There we go. So we're going to clean him up here, and then he'll put on, he has a wrap that he wears, and I can see significantly, he's almost straight here now, so just a little bit of contour here, but we're going to get in 3 weeks, we'll come back and we'll put up the before and afters for you. And so you can see exactly how he's progressed. Hello, how are you? He's done really well. I can see how the good results. How much fat or a difference, let's say if you were to get it around your belly area, sometimes you can see as much as 6 inches, decrease in fat. So that's something to think about, possibly even seeing 6 inches. So 3 treatments at least, sometimes up to 6. And it just depends on how your body does with it. Some people will call in and they'll say, hey, I have a lot of swelling and itching. Strangely enough, if you have a lot of swelling and itching, those are the people that actually do the best with the procedure. I have a question. Someone said, can you do this to get rid of side boob fat? I'm sure you can. I'm always super cautious when it comes to doing things that are related to the breast, just because of course, breast tissue and breast cancer, those sort of things. I would have to see. It depends if you're speaking of this area here, which is not necessarily breast tissue, absolutely. But the breast itself, that's not an area that I I'm not comfortable doing it in that area just because I wouldn't want, I wouldn't want anything to be, would be hindered when imaging and that sort of thing afterwards. So I'm not super crazy about doing it on the breast, but if it's the area in this region here, absolutely you could do it in that area. I consider that part of the back. Bariatric surgery, the bypasses, and that sort of thing. But I also saw a lot of the complications that took place with those. People had significant amounts of depression. They also had, because there's an issue with protein processing and malnutrition. So there's definitely a difference there. Not to say that there's not a place for surgery. For bariatric surgery, there are some patients that I do recommend that that's the route that they go. But I think, in my opinion, that you need to bring them all together, and they really should work as one. When it comes to medical weight loss, what I do, which is non-surgical, yes, there are medications that I offer, but it's not the end-all be-all. Everyone that comes into my office, it's not actually determined that they need to have a medication. It may just be coaching that they need to have, which could be a part of all three of these different areas of weight loss. Some patients come in and I end up checking blood work, like their hormones, and perimenopausal people, someone that has polycystic ovarian syndrome. I may simply replace the hormones for these patients, and they end up losing weight in that way. So really, when it comes to a medical practice where you have an MD or maybe a nurse practitioner or something along those lines, we do have more tools that we can use. Medications, of course, which you have to be licensed to prescribe, but I also use those things that tend to be more natural. I use, patients may come in and they'll say, you know what, doc, I really don't want to take, my body is really sensitive to these other medications. I really don't want to take a medication. I'd like to try something that's more natural. So for a patient like that, I typically will recommend maybe a B12 NIC injections, fat burning injection that I have in my office, that many people lose quite a bit of weight simply being on that medication. We also have herbal fat burners, which are natural, that we offer in the office. We have the meal replacement shakes that we also offer in the office because we know of the importance of having a decent amount of protein in our diet if we want to lose weight. So I normally talk to the patients, find out, get a good history and physical on them, and determine what the reason is as to why they haven't been able to lose weight or maintain it, and then I formulate a plan based on that. And that plan is not necessarily something that it requires a physician to write for or prescribe. I move across all the different areas and find out what works for the patient.
Okay, yeah, it definitely makes sense. So it's more about creating that comprehensive plan based off of their unique, health history.
Absolutely.
Okay. And with something like, the semaglutide and Wegovy, I know a lot of patients have heard about that. Is that something that you would employ or would be a good fit for some of those patients?
Well, it just depends. It depends on what the reason is as to why they haven't been able to lose weight. Wegovy, if you look at the different pathways in the brain that cause us to gain weight or not be able to lose weight, I will say that I do have people that have had bariatric surgery or bariatric procedures that they have still gained the weight back, or they didn't lose the weight that they thought they would, so they end up coming in to see me. And that's a decent amount, probably about 20% of what I see in my practice are people that have not reached their goals or start to regain weight. So what that tells us is that we can reroute things, make things smaller physically, but if we don't change the brain and the mind and how we think about food or our relationship with food, then it's not necessarily going to work. So that's where semaglutide comes in. Your pathways in the brain that cause us to overeat, and we can eat out of boredom, we can eat out of anxiety or emotional eater, and then there's that person that doesn't feel full. That's where semaglutide really helps them, okay? So semaglutide, it slows the emptying of the stomach, okay? And it also, so it causes satiety. Satiety is where we feel full. Protein helps there as well. So semaglutide works in that area. It also helps with insulin, increasing the release of insulin if that's something that is needed. So when you have people that come in and they tell me, when I get a good history about them, why do you think that you've not been able to lose weight? And they say, Doc, I'm just hungry all the time. That's a person I know, you know what? semaglutide is probably going to be a really good option for them. There may also be sometimes when they will say to me, well, you know what, doc, I get up in the middle of the night and I'm an emotional eater, or I go all day long and I don't eat, and then I get up in the middle of the night and I decide that I'm going to have something to eat, or I have cravings, and when I hear that word craving, then I have a certain medication that I know will probably be good for them when it comes to cravings, okay? So it really just depends on what the reason is for them actually overeating.
Yeah, it definitely makes sense. And I know it was originally approved as a diabetes medication, but it sounds like there's been quite a bit that's gone into, using it as a weight loss medication as well, right?
Well, yes. Years and years ago, I used to give patients Byetta. Byetta actually was the very first one that was actually in this category. It's twice a day injectable. So what they found out was that it actually crosses the blood-brain barrier and actually causes us to not be hungry as much. And I talked about the different ways that it actually does that. So initially it was a medication for weight loss. Or for diabetes, I'm sorry, but now we have those that are being approved and used for weight loss. We've got the Wegovy, which is out there. We've got the Mounjaro, which is getting ready to be approved also. Now, all of them can help you lose weight, but there are those that have the FDA approval for losing weight, and then there are some that work better than others. Years ago, they came in and I used to prescribe Saxenda. Saxenda is a daily injectable. Now the ones that we're using now that are super popular are once a week, so it's a lot more attractive to patients if they only have to use an injection once a week as opposed to every day.
Yeah, that definitely makes sense. And what are some of the the average results or things? I know vary patient to patient, but what type of results would you be expecting to see with somebody using the semaglutide if they're a good fit for it?
It just really depends. It depends on the reason as to why they have not been able to lose weight. If they're an emotional eater, semaglutide might not necessarily be the best option for them. If there's someone, like I said, that really can't, they just don't feel full, then that's a person that more than likely the semaglutide will work pretty well for them. If you look at studies have shown, minus the Saxenda, with the newer Wegovy and Mounjaro, that you can lose about 15% of your initial weight. I'm seeing pretty good results. I have some patients that I saw a lady in the office just the other day, and she lost, I want to say since August, she's lost about 50, 60 pounds. She didn't. So she's probably at about 20% of her weight loss since August. So it really just depends. But I do have some people that will hit plateaus, because remember, our body has natural plateaus. Studies have shown that when we gain weight, we don't get that weight off within the first year, that our body has a new set point. Okay, so once we start to lose the weight, when we hit these set points, now we hear patients talk about it all the time, so it's really great that we now have some studies to document it. They would say, Doc, you know what, I lose weight, and then when I get to 179, I get stuck right there, okay? So we know now that people have these set points, and actually even after losing the weight, studies have shown that 6 years later, our body may still be trying to bring us back to that set point that we used to have, okay? So with that being said, it just really depends on if you're combining something else with it. Some of my patients choose to combine, they might combine phentermine with it, especially if they get stuck at a certain point. They may decide to combine the B12 injections, fat burning injections with it. If they're an emotional eater, they may decide to add some bupropion to it. If they have cravings, they might decide to add topiramate. So what I'm stating here is basically that there's not necessarily just one medication that you would pick up. It really depends on what other issues or concerns that the patient has and what's been keeping them from being able to lose weight.
Yeah, it definitely makes sense. And I would imagine too, it relies a lot on the following the diet plan that you said and doing the exercise and everything to really get the most out of it, versus just taking medication and pretty much keeping the same lifestyle, same eating habits and everything that you had before.
Well, definitely. When a patient comes in, that's one of the first things that we do. Not only getting a physical for blood work, because many people don't know. I can't tell you how many patients I've diagnosed with having being diabetic or having thyroid issues, that actually didn't know that they had these things going on. And that's important to know because when people, let's say, for instance, when they have issues with their thyroid, that's a metabolism issue. So there's different medications that you're going to use for those people. So the physical, the blood work, and then we typically talk about their diet and what they've tried and what's worked for them and what has not worked for them. When it comes to science and losing weight, studies have shown that it's really all about the calories and fats. So we talk about how to track them, how to become very familiar with them. And some people are intimidated by this in the beginning, but like I tell my patients, it becomes much easier over time and really almost like second nature. Just knowing, okay, a banana is roughly 100 calories. Two of the little oranges or tangerines, that's about 100 calories, So these things become very easy over time, they do. And then patients, I usually recommend that they use a couple of the apps, whether they're using if they have an Apple, they can keep track on there. They can also use MyFitnessPal or Use It. Those are other options that they can use to really just become very familiar with their diet and those foods that they seem to be able to lose weight eating and those that that are really just not their friend. And then we talk about exercise. But honestly, it's really more about the diet, about the calories and the fat. And then when you talk about diet, a lot of people say, I don't like that word diet. When I think about diet, it's really all about the way you choose to eat, okay? So what I also tell patients, by the time they come to me, they usually have tried so many different things, which is perfectly fine. There's a lot of information out here, and I tell them, you probably have all the tools that you need, you just don't know how to use them. For instance, there's a good thing about every diet, at least the ones that, for instance, the Atkins diet, it's great to cut your carbs, especially if you want to lose fat. Studies have shown that cutting your carbs is actually the best way to guarantee that you're going to lose fat. But I don't agree with the high fat diet. I don't, because a lot of those people can lose the weight, can be really thin, but then they have all this cholesterol, this fat inside their arteries, and they have heart attacks, So I don't agree with that part of the diet. When you talk about intermittent fasting, a lot of people say, what, Doc, I've decided to use intermittent fasting. If they go on the internet, though, and they see what they have there, they talk about intermittent fasting being from 12 p.m. to 8 at night. From what I've experienced in my office and from some of the studies that are taking place, there's something we call a circadian rhythm as to how we determine that we're going to burn those calories. What I've seen is that most of us burn less calories in the night, and it's just from my personal experience. So I tell people, you can go ahead and use the intermittent fasting, and I have people that have really great results, but I recommend that they do that between the hours of 10:30 and 4:30 or so, So all these different things are things that I talk to them about. Even when we talk about the exercise, many people think, I'm a busy mother, I'm an entrepreneur, I also have my own practice, I'm married, I have my husband, I have 5 children, so I'm always busy and doing something, So people talk about going to the gym. Doc, I really feel like I need to go to the gym, and they get really upset with themselves. When studies have actually shown that you can exercise intermittently throughout the day, maybe 10 minutes, 3 times a day, and get just as much benefit, maybe even more, than going to the gym for, an hour during the daytime. I know for me, getting ready for the gym, it might take me an hour and a half out of my time in a day, and I just don't have that kind of time to spare. So when it comes to exercise, it's really more, losing weight is really more about the calories and the fat. Exercise is really just kind of the cherry on the top, and definitely something to encourage, but you can do it at home if you need to.
Yeah, absolutely. No, I completely agree. I think it's very important to focus on finding a plan that's actually sustainable for them too, and they're going to be able to continue that long term, as opposed to, maybe trying something for a month or two and it's just so much of a strain and so different that there's just no way they're going to continue it.
For sure.
Mm-hmm. And with using one of those plans or something like semaglutide, how long do they typically need to stay on that? Do they typically do like a maintenance dose, or is it just like 6 months and then they come off of it?
Well, it really just depends. Okay, I know studies have shown, I believe that if you come off of semaglutide, that you're going to regain weight. And I mean, that's typical for many of the medications that we take to lose weight. But what I will tell you is that obesity, being overweight, is a chronic medical problem. 70% of it is actually related to our genetics. So when I say chronic, I mean it needs to be put in the same category as high blood pressure, is diabetes, is elevated cholesterol, because it's something that you're probably not going to be able to totally walk away from ever, no matter what you do. Now, can you take breaks? Absolutely. And I have some people that have come back now that lost weight with me 5 years ago, and they noticed that they gained 20 pounds or 30 pounds and couldn't get it off, and they came right back and said, Doc, I need your help. Please get me jump started. And I think that's the key. That's the key, is to know when we need to look for help again. And that relationship that you form with your weight loss provider is probably a lifelong relationship that you'll have. And that's okay. So you don't necessarily have to stay on the medications for, let's say, 5 years, but I usually recommend that patients at least check back in every 3 to 6 months so we can evaluate if there's any changes that need to take place, because you don't want it to snowball and for someone to gain. You know, I see some people that have come back in after COVID and they've gained, some of them, almost 100 pounds, and that's too much.
Yeah, definitely. And when should somebody, seek professional help and really seek out, the help of someone like you?
Well, really, if what you're using is not working, like I said, with the internet, there's going to be a lot of information out there. A lot of people come in and they just, they've read all these different things and they just really don't know how to apply them. So it really just kind of depends. But if you beat your head against the wall and it's just not working out, I offer about 54 different combinations of medications and treatments in my office. So more than likely, I've got something in the arsenal that's going to help you lose the weight that you need to lose. Other people may be trying to lose weight to have surgery. When you go and see the orthopedic surgeon, the bone doctor, and they say, you know what, you need to lose 10 pounds before I put a new knee in. That's someone that may come a lot sooner to see me, because they're tired of being in pain. They want to go ahead and just lose this weight and and be done with it so they can have the surgery and feel better. Maybe someone who's losing weight for a graduation or for a wedding. We want to get in a wedding gown. Depending on how soon that's taking place and how many dress sizes you're looking to come down. I'd love to have a year. I'd like to see people within a year so I can get them the weight loss that they need, especially if we've not worked together before. Because even those that I've worked with in the past, what worked before doesn't always work the second time around also. So it makes me more comfortable to have 6 months to a year. But I mean, I can work with 4 weeks. I can work with 8 weeks as well. Now, I might not get you the total results that you're looking for, but we can at least get you approaching what you're looking to do.
Well, that's really great to hear. And what would be the best way for patients to get in contact with you there if they were interested in coming in to see you?
Well, you can look at my website, slimmerimage.com, and you can also go to, you can call our phone number, which is 614-577-1948. And then you can also join my Go Lives on Thursdays at 12:30 p.m. and it's on Instagram, and it's at TheRealDr, or Dr.G. So.
Okay, awesome. And yeah, those were the questions that I had for you. Is there any last advice or anything you want to leave them with if they're thinking about any of these treatments that we talked about?
Well, just stay encouraged. Don't get discouraged. I know there's a lot going on. There's a lot of information out there. Like I said, what worked in the beginning doesn't always work in the end. But just having someone by your side to coach you and walk you through and cipher through the information, I think is a great option. And I'm super excited to be a part of anyone's weight loss journey.
Yeah, absolutely. I think taking that first step and really just getting help is definitely the most important part.
Absolutely.
Definitely. All right, awesome. Yeah, I love the work you're doing there, and I really appreciate you taking the time to talk with us today and share the education. So thank you so much for doing that.
All right. Well, thank you so much for having me. People don't realize it, but breast cancer and obesity there's a connection there. So when you think about, of course, I'm sure everyone appropriately is seeing their primary care doctor, and getting their mammograms, and getting their breast exam on a regular basis, but also think about having a conversation about losing weight if that's something that you need to do, because obesity or being overweight has been linked to breast cancer as well as other cancers, even prostate cancer for men. So I want you to think about that as well. It's not just about diabetes, it's not just about high blood pressure. Of course, losing weight can help with joint pain and arthritis, but also heart disease. Think about that as well, because a lot of people think that breast cancer, most women are just really afraid of breast cancer, not to state that you should not be, but the number one killer of all women is still heart disease, and heart disease, of course, is linked to being overweight or obese. So many different reasons why we want to make sure that we're taking care of ourselves and paying attention to our weight, because it's interlinked with other things that can actually cause a disease or even death in us. So with that being said, where do I usually like to start with people when it comes to weight? I usually like to start with diet. I like to make it simple, I like to make it relatable, something that fits within the time constraints of someone's lifestyle, okay? I'm never going to tell someone that you need to exercise 5 days a week, 2 hours a day. It has to be something that you're able to fit into your lifestyle, because when it comes to losing weight, it really does need to be a change for the better, a change that is something that you can continue with the rest of your life. Something that you basically you need to maintain, not just lose, but you need to be able to maintain that weight loss, okay? With that being said, if you're interested in consultation, you can either DM me or you can go to slimmerimage.com. Also, if you look in my bio, there's a link there as well. With that being said, that's all I have to say today. And if you have any questions, go ahead and drop them in the comments box. Go ahead and follow, like, share, give me a thumbs up, and I will see you on next Thursday at 12:30 p.m. Eastern Standard Time. And thanks for joining me. Something called a PRP facial or vampire facelift that you have, which draws blood, and it uses platelets that you put on the skin, and then you use a dermapen or something that pretty much pushes it down underneath the skin. And what that does is the platelets have a way of encouraging collagen and elastin to form also, so that will give you like a facelift. So that will also help to stimulate collagen or tightening of the skin. Fillers. You have fillers which are very similar to what we have in our body, which you can place in the different areas where you have the fat pads that drop down. You have some that actually stimulate your body to form its own collagen, which are the biostimulating fillers, which is a great place to go. Radius is one of those. That's something to think about. Sculpture is also one, and they last quite a bit of time, so that's something you can think about. And then PDO threads, which is something that I do here in the office, which is suture that is placed back underneath the skin, and it lifts, but at the same time, once they break down, which is customarily over about 6 weeks, then it stimulates collagen to form, and the face tends to look fuller and lifted. And I've had some really good results recently, ever since I've been doing the PDO threads, which has been for several years now. Really good results that people have seen with this. And I mean, all of these procedures are permanent or semi-permanent, except the PRP facial, which is something that you would have to repeat, and I would say yearly. So these are options. And then also Retin-A. There's certain creams that will stimulate collagen and elastin to be formed. And the big thing is the things that you're doing to your body. For instance, I would recommend that you do not smoke, because smoking, of course, causes damage to the skin anyway. And most people that I see in my practice have given up smoking, so that's something that I always encourage them to do. You guys had the chance to enjoy it this beautiful day just yet? Some of you? Okay. I can't wait to get out there and enjoy it and get some walking, maybe some exercise, something like that outdoors. Be nice. Suck up some sun. Seeing as we just haven't had the best weather this year, but it's coming. So for those of you that are joining me for the first time today, what I normally do is basically give a recap of different things that I've seen or talked about in the past. And also maybe talk about an interesting patient that has come in. We've been really busy in the office, so It's very complicated or hard for me to pick one patient, but I do have a couple patients actually today, just real quick blurbs about them. But I want to start with the cosmetics because that's just kind of the beginning, and then the end we're going to talk a little bit about why we're all so interested in losing weight. Most people that come in to lose weight, it's really more about physical, so I wanted to dig into the not so happy things about why we should be losing weight, and we'll pick one today, and then I'll continue for the next 4 or 5 weeks in celebration of Women's Health Month, which is actually this month. So I wanted to just kind of talk about the reasons or the different things that we need to do in order to lose weight, or why we should lose weight to live longer and for our health, rather than just to look a certain way. Some of the things that I do when I get ready for vacation or to go away, some things that I do is I do touch up my Botox. Botox brow lift usually. Also in my 11s there, that's something that I did before I went. And also filler along the nasal labial fold, because of course as I lose weight, then typically you get more of a fold in this area here, and I just didn't want to have that for Vegas, so I chose to fill that up as well. And just recently I had a laser facial. Okay, people say, okay, well, African American skin, and you said laser what? That's really and that is a thought, because I've been seeing some of the people that are on Instagram that have had bad results. Hello, how are you with having a laser treatment with African American skin? But I'm here to tell you, we can do laser with our skin. It was a nano and a pico laser, which really, it doesn't use heat, it uses light. Thank you. And so it's actually safe for us. And I'm happy about the results. It's been probably about 2-3 weeks now. Hello, how are you? And great thing about it is it helps make your pores smaller. And I'm also noticing a difference underneath the chin as well with the Pico Nano laser. So you can get it every 3 to 4 months. So it was my first treatment. I did first have like a test patch area along the side where you couldn't see it. Yes, thank you, hon. So it and then I went back weeks later to have the actual procedure, and then we also pre-treated with hydroquinone, which is like a bleaching cream also, which helps even out the skin tone, and it also keeps you from forming. Because when you do laser to African American skin, sometimes even with chemical peels, sometimes our skin can respond by actually getting darker. So this was a way to make sure that wouldn't happen, because that would kind of be counterproductive, because the laser itself actually evens out your skin tone as well. So it wouldn't be, you wouldn't want to actually have hyperpigmentation or darkening of the skin when that's actually what you're trying to treat. But I'm super excited about it, because it was crazy when I decided to have the procedure done. I noticed that I had some kind of darkening along this line through here, which is very common for people that your hormones are off. It's called melasma, or you can have it in pregnancy as well. Of course, you're not going to get a laser treatment during pregnancy, but during pregnancy, when the hormones are off, you can get a discoloration which runs along this area also. And so that was one of the main reasons also why I wanted to give a try for the laser treatment on my face. So I'll let you guys know next time, and I think I did take some videos afterwards. I'll post a before and afters in the next week or two. But I was a little bit red on a scale of 1 to 10 of how sensitive it is. I mean, it's like a little buzz, and it's very quick. I think the whole treatment took roughly about 5-10 minutes for the first portion, and then there was a numbing cream that was put on, and after that it took probably about 30 minutes to numb up, and then another 5-10 minutes. So I would definitely do it again. I didn't think it was bad at all, but the numbing cream, as I was told by the person that was doing it, is definitely something that you want to make sure that you have in place when you get the final portion of the treatment. But yeah, so you guys, if you haven't heard it before, laser, nano, pico laser, great thing. This is something that I am looking to start offering in my office as well, and it's going to be more than likely at my new office. So I'm super excited about this. Okay, I wanted to talk to you guys. There was a time in April the 11th to 17th was actually Black Maternal Health Week. Why is this important? It's because there's been really no improvements in morbidity and mortality for Black women that are giving birth. So there's a real push now to educate people about the things that you can do in order to not become a statistic when it comes to being an African American female and giving birth. And one of those things that is listed as a high risk for Black women is actually being overweight or obese. So I thought this was perfect. I had a young lady in the office yesterday that has been with me for probably about 4 or 5 years, who I helped lose weight, and she was able to finally have a child and get pregnant. Her first child, this is her second, her first child I want to say is almost 18 years old. So I know recently I've been seeing in the news where they've been saying, you know what, it really doesn't change your fertility if you're overweight or obese or not. I beg to differ. I see women all the time come into my office and lose weight or couldn't get pregnant. We're going through fertility treatments, and then they come in and they lose weight and are actually able to get pregnant. And so I think that it does help, okay? But the great thing about it is not only does it help you get pregnant, but it's also going to improve your outcomes once you get pregnant, okay? Just some statistics. 44 in every 100,000 Black women actually die from being pregnant, and that's twice as much as white women or Caucasian women, and it's 3 times as much as Hispanic women, okay? And about 27% of everyone that gets pregnant becomes pregnant is already overweight. They're or obese. There's some issues for the baby, not just the baby, but also for the mother, okay? The mother, of course, possibilities of gestational diabetes. I had gestational diabetes myself. Actually, with 4 of my pregnancies, I had gestational diabetes. And if you end up with gestational diabetes, which I think most of us have heard of diabetes, but if it is gestational, that just means that it took place during pregnancy, okay? But if you have gestational diabetes, so that puts you at a higher risk of actually having diabetes at a later time in life. So that's why I've always been very much concerned about keeping my weight down and making sure that I do what I need to do, so hopefully I won't end up with diabetes, okay? Problems with sleep apnea also for the mother, and then preeclampsia, which is kind of, to be simple about that, a high blood pressure that can take place during pregnancy, which is super important because, I mean, it can also lead to death. People can die from that. Okay, so ideal weight for an African American female. A lot of people think, okay, they say the BMI or body mass index, the height versus the weight, is really not for us as African American women. But if you look at what is healthy, you know, heart disease is one thing that we think about, but studies have shown that our BMI should be between the ranges of 26 to 28 versus Caucasian, which is between 18 and 25. So we do get a little bit extra weight that we can actually hold and still be healthy and have a longer lifespan. Okay, anything above that is going to be sufficient to interfere with the outcomes of pregnancy or even our ability to have a healthy childbirth. Okay, so with all of that being said, you know, fertility can be improved if one loses weight first, less likely to be gestational diabetic. You're going to have a more successful pregnancy, meaning you're going to be able to carry that pregnancy to term more than likely, because when you have someone who is overweight or obese, that increases the chances of stillbirth or the baby having heart disease, and so many different reasons to lose weight before we go into pregnancy. And usually when we lose weight before going into pregnancy, we usually end up being able to get our pre-pregnancy body back faster, okay? So options for weight loss, I talked earlier about semaglutide, but there's so many different options for weight loss when someone comes to see me. Adipex, of course, is one that so many people know about. It's been around for such a long time. You've also got, when you talk about semaglutide, which is an injection, you also have a pill form of that, which is Rybelsus, which is something that can be used also. I will also say that none of these medications are okay during pregnancy. I tell every woman that comes into my office that it is not okay to get pregnant on any of the drugs that I give you to actually lose weight. So we do normally check pregnancy tests on a regular basis. So you want to plan. If you're looking to get pregnant, then you're going to need to be on some birth control, more than likely. I would usually tell my patients to give it about a year and a half to lose the weight, and then come off the medications and give it some time, and then choose to go ahead and get pregnant. Okay. Of course, these medications, Contrave, Qsymia, all these different medications just allow us to be disciplined, okay? Disciplined with the things that we need to do to lose weight. We know that losing weight is really all about, it's all about diet and exercise, and also calories and fat, okay? So really the medications can't necessarily help you exercise, but Adipex does give you energy. Hello, so a lot of people do talk about how much energy they have when they are on Adipex, but more than likely they just allow you to stick with the diet regimen that we talk about, so it helps us with the discipline, okay? This popular drug I keep talking about with the semaglutide, there's a couple different forms. You guys probably heard of the Wegovy, Ozempic, there's even Mounjaro. This actually medication is being offered by a couple of the other weight loss programs out there now, but I know Jenny Craig just announced this week on Monday that this medication is actually causing them to consider bankruptcy. So it's super, super popular. So you have the Wegovys, you have the Ozempic. A common question that people ask me is, can you use this medication when you're not diabetic? Because remember, it was originally used in diabetics. Absolutely, you can. You don't have anything to worry about it making your blood sugars go low. The big thing to think about is major contraindication, a major reason why you can't use it is if you have a history of thyroid disease or someone in your family has actually had thyroid cancer. Thank you, sweetheart. Those are the people that don't want to use this medication. How does it work, and is it for everybody? I think it works well, but it's really going to depend on the reason for why you've actually gained weight. I see probably about 5% of people that are slow responders or non-responders. It is dose dependent. Most people need to reach a certain dose over several weeks of treatment in order to really start to see good results. I do have some people that might, within the first week or two, lose 5-10 pounds. I mean, it just really just depends, but the big thing is to have a plan and just remain patient and don't give up on the medication. How it works is it makes you feel full, okay? So if the reason why you were unable to lose weight is because you were always overeating, it's a great drug for that person. If you're an emotional eater, then it might take adding another medication to kind of deal with those emotions that are overriding your ability to stop eating. So it really just depends on the reason for it. Some more things about it is a weekly injection, but the needle is super, super tiny. Most people, when I give them the injection in the office, they say they can't even feel it. So it is FDA approved for this as well. Initially, when it first came out, they were talking about over 104 weeks, losing about 15% of your weight. It just depends. I see some people that lose a lot more, other people that it takes a little bit longer. Will you have to be on this medication for the rest of your life? Not necessarily, but we always have to realize that being overweight or obesity is something that more than likely is based on our genetics, and you're going to have an issue with it for or be concerned about it for the rest of your life. There's some studies that are out that talk about a reset of our baselines. You know how people would always come in and they would say to me, Doc, I can get to 170, but I can never seem to get below 170. Our body resets at these different levels, okay? So what we have to do is recognize that even some of the studies have shown that after losing, let's say, 20, 30 pounds, even if we keep that weight off for 2 years, 3 years, our body is still trying to push back. It's still trying to push back to that point that it was accustomed to being at. So you may have to come in from time to time and start a medication again. The big thing is just not allowing it to get out of control. I do have people that come off of the medication and they just come back when they need it again, or when things kind of start to change for them. Okay, my own personal experience, I know that when I first started on the medication, my main issue was I couldn't totally be consistent for long periods of time. My diet was actually pretty good. I move a lot, I exercise a lot, not organized exercise, but I get a lot of exercise running around at my job and everything, and I'm a pretty active person, but I have these cravings for sweets. I love carbs. Most women love carbs. And so about 2 days a week, that would be, it might be a strawberry shortcake. It might be a banana nut bread or something along those lines. And I don't like to deprive myself. So what the medication was able to do for me was to allow me not to feel, or to feel full and not to desire consistently to eat these items during the week. It took me probably till about the 8th week. I really wasn't seeing much weight loss then. At the end of that 8th week, I tell you, I must have dropped like 8 pounds in 1 week. It was crazy. So that's just my story. My story is not going to be what everyone else's story is, but I do think if you just remain consistent, which is what I've seen in my office, that you will be able to lose the weight. If not with this drug, then with another drug. People do come in and say, well, doc, what's the best drug for me? What's the best medication for me to take? And it's really not necessarily any one drug for everyone or any one medication or plan for everyone. It just depends on that person, and that's what I always tell them. I don't favor any of the medications over others, okay? Usually I just perform a physical, talk to patients about the things that they tried before and what makes them overeat and why they believe that they haven't been successful, and that's how I choose medications or options for patients. And some people, I don't even put them on a medication, so it's really about spending the time, remaining consistent, and having a plan. Okay, so if you guys have any questions, I will go ahead and stop there. I usually go live on Thursdays at 12:30 p.m. and that's Eastern Standard Time. Have been off a few weeks now because I've just been super busy. So I'll start to be more consistent now. Next week, hopefully, we'll be at the site, Foundation Port, and we'll be able to talk about some of the other things that we're going to be offering besides more of cosmetics in our new space. So hopefully everyone's enjoying their day.